Our next speakers will be Philippa Clarke and Grace Noppert of the University of Michigan Institute for Social Research, again, right up the street from me, presenting about a national neighborhood data resource to understand inequities in the health and socioeconomic impacts of COVID-19 in the United States. Grace and Philippa, the floor is yours.
Hi, so I'm Grace Noppert. I'm going to start us off here, and then I'm going to hand it over to my co-principal investigator, Philippa Clarke, and she's going to walk us through the project a little bit more. But let me just start off by saying that we are so excited to be part of the consortium. It's been really energizing to hear all the presentations today, and my mind is kind of just blown up with ideas for collaboration. So thank you so much for having us and for organizing this. So the work that we're going to be presenting on for the UO1 is really an expansion of the NANDA resource that that she's been leading for years and that she's going to talk about a little bit further now. And the real idea here is to really understand how the health of neighborhoods have changed since COVID. And I think that's really important work. And I think it also correlates a lot with what other folks are doing. So if you have ideas for collaboration, please do contact us. I also want to acknowledge our great funders who I think are here for the National Institutes of Nursing Research and Minority Health and Health Disparities. We are actually a team of neighborhood researchers. Many of us are epidemiologists. That seems to be a theme for today. So it's me and Philippa, and then we have a team of Kathleen Soul and Karina Grunland, Jessica Finley, Amy Pientas, who's also here today, and Felix Cabo. And I'm going to hand it over to Philippa to get into the nitty-gritty of the project.
Great, thanks, Grace. So let me tell you a little bit about what our project is, and this is the National Neighborhood Data Archive, or NANDA for short. And NANDA has actually been a project that's been ongoing and is really arisen from the work that Grace and I have done, as well as other researchers on our team, looking at neighborhoods and their relationship with health. And when we mean neighborhoods, we mean things like, small areas like block group level, but also person-centered neighborhoods or kernel density-based measures, neighborhoods or census tracts or counties, but really getting at the more granular level of the environment that people live in and how it can shape the health outcomes of individuals across time. My work is mostly focused on older adults with respect to understanding disability. So we've done a lot of work looking at the neighborhood context that shapes disability outcomes, but also cognitive health. More recently, we've been looking at sort of identifying what are those features in the neighborhood, the local environment that can actually help to mitigate cognitive decline with aging. So access to healthy food sources, but also access to opportunities for physical activity, for intellectual stimulation, and for social interaction, things like libraries, community centers, senior centers, and religious institutions as well. And so what we've found in this kind of neighborhood research is that many people have been doing this kind of work and creating neighborhood measures, but everyone's doing it all in their own little silo, and there hasn't been much standardization in terms of the measurement of neighborhoods, and not much similarity in the actual kinds of measures that are created and used in analysis. So we created NANDA for two purposes: one, to standardize measures of neighborhoods, so in essence really a common data element for neighborhood researchers, but also to just share data publicly. So these are not identifiable data, they're just measures of neighborhood characteristics, and to make these available for other people to use. So it's just a national archive. I should say that our NANDA data are national. So this is a nationwide measures that we have that go back as far as 2000 publicly, but also back to 1990 in our own data that haven't been released yet. And it covers the entire United States, so rural and urban areas. And as I said, it covers multiple definitions of neighborhoods, so multiple spatial scales, at the level of census tracts, zip code tabulation areas, counties, and other smaller areas as well. So our premise is that to understand COVID and understand the social, behavioral, and economic consequences of COVID, we need to understand the context in which the pandemic has unfolded. So that means understanding which neighborhoods have actually been protective of COVID and which neighborhoods are also perhaps most vulnerable to the fallout of COVID as well. So the purpose of the UO1 is actually to then build out our NANDA resource with new and updated measures of the neighborhood environment since before and since the pandemic, and to identify which neighborhoods have actually undergone the greatest change in the social and economic indicators since the pandemic. And also we're interested in looking at long-term trajectories of neighborhood change before the pandemic. What we mean by this is, if neighborhoods are not static, they evolve, they change over time. And we were interested in seeing whether there actually were maybe long-term patterns of change that were going on before the pandemic at the local community level that might place certain neighborhoods at greater risk for residents being infected or their businesses being more likely to close in the pandemic, to really understand which neighborhoods and which residents of those neighborhoods are at greatest risk since the pandemic. So what we're going to be, as Grace was saying, we're one of the newly funded projects. We've just been funded since April of 2022. And so we've been really focusing on actually getting our raw data in-house to create new measures that we can release publicly through the NANDA archive, which is on ICPSR. And so, for example, we're using the new data released from the census and the American Community Survey to update our measures of neighborhood socioeconomic status. This includes measures of neighborhood affluence, which is really capturing social capital, social and economic capital, that we find is more predictive of health outcomes than a measure of neighborhood disadvantage. We also have new measures that we're creating on racial income inequality. So while there are measures of inequality, income inequality more generally, these are specifically looking at the differences in income between whites and blacks in a neighborhood. Again, these are usually the measures that we create are most likely at the census tract level, but they, or the zip code level with a zip code tabulation area. We're also updating our measure of street connectivity with the 2020 census data as well, so that these will be more in line with the exposures during the pandemic. Street connectivity may be particularly important for being able to maintain physical activity and social interaction at the height of the pandemic, because it provides opportunity to be out and about in more socially distanced ways that may not be possible when there are not walkable streets, essentially. So that's a potentially important measure. We also have pretty extensive measures of other features of environments that are based on infrastructure, so broadband, internet, availability and connections at the census tract level and zip code level as well. Again, highly relevant for issues related to the pandemic in terms of telemedicine and schooling and being able to work from home as well. We also, a lot of our data is also based on a proprietary database called the National Establishment Time Series Database. These are measures of, they're just business data that are coming from Dun & Bradstreet that are then linked over time to create a time series longitudinal metric of different business types. So we have permission to use these data and aggregate them again at the neighborhood level and release them publicly for others to use. And so we have a lot of measures that are using these data, and we're going to be updating them with the new NETS data that's being anticipated to be released in the fall of 2022. So in the next couple of months or so. And those data will include things and not allow us to create and augment our data on the counts and per capita density of things like bars and nightclubs, grocery stores, dollar stores, religious institutions and libraries, all things that are related to changes in neighborhoods and how the pandemic has changed the context in which people are experiencing the pandemic. In addition, we also have a lot of other measures on the social services in local neighborhoods. So things like child daycare services, our family social service agencies, police and fire departments, as well as multiple measures of healthcare in terms of dentists and physicians and mental health providers as well. So again, these are all at a pretty granular level with respect to exposures. They're getting down away from the county level to more micro level of the census tract and the features that are really more proximate to where individuals are exposed. We are also hoping that with these new data to actually look at trying to create measures of business closures, permanent business closures. So where have the businesses been closing permanently since the pandemic, which neighborhoods and which types of businesses are being permanently closing. And to what extent is this related to things like third spaces or third places where are informal gathering places that provide a connection point for members of a community. And as I said before, we're also going to be looking at longitudinal trajectories of change in neighborhoods before the pandemic. Which were the neighborhoods that had the greatest growth or decline in certain types of businesses, and how might that actually have changed what the neighborhoods look like since the pandemic, and as a consequence, what are the impacts for the people who are living in those places? So again, our purpose in the UO1 is to really build out what we've got. We're very interested to hear from you and let us know if there are certain types of measures or kinds of measures that would be helpful in support of your research. And we are continuing to kind of push forward and develop novel metrics to kind of think about how we might actually understand the context in which the pandemic is playing itself out in the United States.